Welcome to Dr. Nasar Shahid's program for prevention of diseases and achieving the well-being. Today, I'm going to go over the anti-inflammatory medication. If you have any kind of pain, you go to the doctor and the first thing they will prescribe is an anti-inflammatory medication. There are many over-the-counter and prescribed anti-inflammatory medication. Most of these medications are heavy on stomach. Most of these medications have lots of side effects, and since they are available over the counter, people sometimes keep on taking. They want to avoid going to the doctors and they keep on taking these medications. Now these medications interfere with their gastrointestinal lining, that interferes with their liver and kidneys, and that interferes with their bleeding tendencies. So it's very important to understand that inflammation is actually a useful process for the body. Using anti-inflammatory medication actually don't put us in a good position. So we have to avoid these medications as much as we can. If there is a pain, taking Tylenol is better than anti-inflammatory medication in few ways. However, anytime there is a question of medication, I'll explain something, but for an individual condition, you have to contact your doctors, because the information on social media can cause more confusion. The understanding of these medication is very important, a basic understanding. Today, I would recommend be your own doctor. Don't let the healthcare provider decide everything about you. A well-informed patient or well-informed educated person has a better chance of choosing the options put in front of him by his or her healthcare provider. So anti-inflammatory medication, if you have to take for a few days as prescribed by your doctor. Sometimes you're taking over-the-counter medication and the doctor also prescribes that without telling you exactly that these are anti-inflammatory medication. So there is more synergistic side effects, accumulative side effects of those. So don't take more than 4 or 5 days and use the other methods to cope with your pain. Again, whenever we talk about pain medication, make sure that you have done the normal pharmacological measures already. They are already in place, like for example the sleeping 7 to 8 hours with good quality, hydration, avoiding those inflammatory medications that can cause an inflammatory food. So to counter, to become to use the anti-inflammatory medication, you have to be aware of all these things. Now comes the use of local anti-inflammatory medication. The best local anti-inflammatory medication is castor oil. Now the advantage of castor oil is that it can go deeper into the tissue. It has least side effects and it is a very powerful anti-inflammatory medication, but it takes longer time to give you the anti-inflammatory effect. So if the inflammation has to be stopped, because the side effects of continuous inflammation can cause degeneration and inflammation and injury. So if you want to use locally in some areas anti-inflammatory medication, the best is castor oil. The oral non-pharmacological non-synthetic medication, natural synthetic medication, I would suggest 2 things. One is turmeric, the other is ginger. And if you combine them, that can provide you a very good anti-inflammatory effect. So taking a 1/4 teaspoonful of turmeric with a little tinge of ginger, putting in a little water and drinking is 2 to 3 times, that can provide you natural anti-inflammatory effect without much side effects as compared to the synthetic medication. Now remember, these measures don't cost anything and you can do it yourself. However, whenever you see you have a certain condition, consulting a doctor and letting them know that you are using these measures is very useful for you to arrest the disease process if it is happening in your joints, nerves, muscles, or anywhere in the body.